Great, thank you. Hello, everyone. I'm Coletta Dorado, founder and CEO of AZZLY, and your moderator today. Thank you for joining our webinar on AI-driven efficiency, the power of AI in clinical documentation. We're excited to be joined by First Dragon Computers Made Effective today to discuss Dragon Medical One's safe and secure artificial intelligence functionality. We'll demonstrate the compatibility of Dragon One Medical with AZZLY Rise, our purpose-built behavioral health and substance use disorder platform. So our agenda today is listed in front of you. We have allowed for 45 minutes, and we're excited to be able to go through and have Bonnie share all her knowledge in regard to First Dragon and also the DAX Copilot functionality, as well as Maria Gray, who will be joining us as well from the AZZLY team to demonstrate how it functions so efficiently in the system. If you have any questions for the panelists, please enter them through the Q&A feature on Zoom. It's on the bottom there. We'll be addressing some of those questions that came in prior, and we did get quite a bit and a wonderful attendance. So thank you so much for joining us today. And we'll get through as many as we can at the end. If we do not get through them all, we promise that we will respond to those questions and share them accordingly. This presentation also will be recorded, so you'll have the benefit of playing it back at another time. So let's start. I have known Bonnie and her team for many years. They offer a unique customer-centric approach by ensuring that each client is trained to proficiency and provided superior support. Most medical practitioners are familiar with Dragon Medical speech recognition. It's been around for quite some time, and it truly has proven itself to be a wonderful tool. We hope to encourage more mental health and substance use disorder providers to take advantage of its benefits. Slight change today, as fellow Dragon team member Matt, his wife went into labor last night and he's got a new baby today. So we're going to be missing Matt on this presentation, but Bonnie is going to be very thorough and answer as many questions as possible that Matt would have covered. Matt was more on the technical side of it. And also we have Maria Gray, LPN, product manager and lead implementation specialist at AZZLY. Maria has over 10 years working with mental health and addiction treatment, medical and clinical staff. Maria's expertise is truly understanding from that nurse perspective, their requirements, their needs, and also very much their frustrations. Maria's nursing background and strong EHR working knowledge assures the staff of a deep understanding of the benefits of adopting technology in their daily workflow. We're thrilled to have Maria on our team. She's been with us for about 8 years now. Thank you for joining today, Maria.
Thank you, Coletta. Thank you, Bonnie.
You're welcome. So let's begin. Bonnie, let's talk about Dragon Medical One. First question to you is basics. What is Dragon Medical One?
Thank you for inviting us to speak to your audience today, Coletta. I would be happy to answer that question. Dragon Medical One is the upgrade to our Dragon Medical Practice Edition series and offers advanced speech recognition that delivers a more productive, personalized documentation experience before, during, and after the patient visit. It is an award-winning speech recognition software, and it was just named Best in Class for the 4th consecutive year. Dragon Medical One captures the complete patient story naturally and efficiently, and is considered a conversational AI workflow assistant and documentation companion. It is based on an affordable subscription model, which includes all support, updates, and upgrades.
Great, Bonnie. Thank you so much for that overview. So as the clients who have joined us today and are interested in Dragon Medical One, how are you and your team from First Dragon able to help them?
Absolutely. So we offer a turnkey solution inclusive of sales, training, and client support. Our support and training teams are certified and US based, and we are happy to offer your clients the ability to trial Dragon Medical One to conduct their own proof of concept with AZZLY Rise. to determine if it's a right fit for them. There is no cost or obligation associated with the trial we are offering your clients.
Great, Bonnie, thank you. Having key partners like you is essential in sharing, the educational benefits and the efficiency benefits that you offer. So thank you for that promotion. So Maria, let's direct one to you. So you work directly with users who provide mental health and addiction treatment services in their programs. What would you say are the biggest challenges for these users in completing their documentation?
First and foremost is timeliness. As much as EHRs have definitely streamlined the workflow for providers of all levels when entering their notes, it still is a timely manner in order to ensure the thoroughness. I believe that having a program such as Dragon, I've experienced this myself, when utilizing it, even in preparation for this, ensures that I have the ability to basically have a template style paragraph laid out, that it covers all of the areas of a patient's documentation that I need to include, allowing me to simply click through and update those statements that may need to be updated, otherwise moving past them with their standard information. So to allow the thoroughness for both charting and billing reasons, as well as saving providers their time, I believe that this is a great product that I look forward to using more.
Maria, just a second question. You deal with users that are 20s, 30s, 40s, 50s, 60s, 70s, 80-year-olds nowadays in mental health and behavioral health. So for those that are used to scribes or transcriptionists, would you see Dragon One being a benefit?
Absolutely. We went from working in almost entire narrative format in documentation to a click-through system. And depending on the needs of the business or the comfortability of the user, having that option to still have all of your documentation laid out, but in a narrative format with the ease of use of just speaking to update areas is definitely a great offer. And as you'll see on my screen, I have fields that I have chosen to use some as drop downs or check boxes and maintain a click-through style, but I also very much appreciate having a quick narrative at the end, and I know that our providers who may not be as comfortable with the click-through process in an EHR spent years documenting through narratives and find this very beneficial.
Excellent. Thank you, Maria, for sharing that. So Bonnie, how does Dragon Medical One help to address many of these challenges that Maria mentioned?
Well, with regard to saving time, based on studies conducted by the developer Nuance / Microsoft, 50% of clinicians are reporting that they're spending less time. Clinicians are reporting that they're spending 50% less time on documentation. So that allows them to have more meaningful patient visits, and it helps eliminate the cognitive burden that they would encounter if they were just writing down their notes or typing them at the after the patient visit.
Excellent. And just to compliment something that you and Maria said, because we're an all-in-one system and we have a very strong revenue cycle management component, I know there's many billers that review documentation for accuracy, for the details, for the level of care that are being serviced in the programs offered. It's so critical to have that detailed information and make sure that the services provided and the documentation being done, that it coincides with the level of care being offered and also the payer requirements. So if you didn't document, it didn't happen. And if you don't have the detail of that documentation in there to support that documentation, medical payers tend to push back, or they may deny a claim. And that hurts not only the providers and the facility, but also the patient. So I'm just really excited that we can offer a tool that can help support that detailed documentation that's required, whether it's a click-through or whether it's in the narrative, as Maria said. So, Maria, for clinicians already using AZZLY Rise in their EHR solution, are they able to document AZZLY Rise using Dragon Medical One? Is it easy? again, you don't use Dragon Medical One day to day. And we brought you in to do this demonstration. How long did it take you? How easy was it?
Coletta, now I will admit for everyone that I did use Dragon One for about the same length of time a couple of years ago when we did a joint webinar. However, I have not utilized it since as a result of my current, position. That said, I did require a brief training that I requested, and I met with a gentleman from Dragon for probably 10 minutes yesterday. And then after that, I was able to set it up with my own styles of paragraphs and settings that I feel comfortable with. And I was a little nervous at the beginning, especially on a webinar, but it was so quick, easy to set up, and I feel confident with the usability of it today.
10 minutes, not bad, huh, Maria?
It definitely beats some other items that we've tried.
I love it. Okay, great. In a moment, Maria will be demonstrating Dragon One Medical within AZZLY Rise. And again, even though it's AZZLY Rise, if you're using an electronic health record system out there, clearly understand that the adaptability is there. It is easily functioning in most electronic health records. I would believe we want to show you how easy it is to use an AZZLY Rise. Bonnie, I want to congratulate you. I understand that you and your team achieved a major milestone recently regarding Nuance, Microsoft Nuance, and DAX Copilot.
That is correct. Yes, we are helping Microsoft launch their new AI-powered clinical documentation solution that we predict will transform patient records management. DAX Copilot is a fully automated clinical documentation application which combines the powers of Dragon Medical One and the PowerMic Mobile with conversational and ambient AI using OpenAI's cutting-edge GPT-4 technology. And just a little summary of DAX Copilot. It records the patient encounter in the exam room. And I think you can see the cell phone there, cell phone app. So it's listening. See that there's a microphone in the bottom right-hand corner. So it records that encounter, the full conversation. It takes the clinically relevant parts of the patient visit and uses Microsoft's AI to create a note within seconds that is delivered to your EHR. It reduces the cognitive burden that I mentioned that DMO also helps with, and the physician burnout while providing a more meaningful conversation with patient.
That is quite exciting. We look forward to, I know the DAX Copilot in behavioral health. It's moving rapidly, and we're excited about you all getting your arms around it. We will schedule an additional webinar, Bonnie, with you. We'd love for you to take a deep dive in DAX. It'll allow for Maria to also get comfortable with the DAX product and be able to demonstrate that for our next webinar in detail. So congratulations on getting that certification. I know it's quite huge, and I like the fact that Microsoft and Nuance is being very selective and really putting you all through extensive training, because AI in healthcare, it's a serious component. It's going to be a valued component. It is the future. We want to embrace it with all arms. We are getting many questions about the safety of using AI to the patient and ensuring that HIPAA compliance, ensuring that payer requirements are being met, that things aren't skipped, and that it's going to provide that detail. In whether patient data, is there risk of it leaving an electronic health record? Can you share some detail in regard to that?
Sure. So let's focus on the Dragon Medical One component. And Dragon Medical One, the voice profile and all the customized commands reside in the Microsoft Azure's cloud, and which is high trust certified. And we have many documents that attest to that fact. And it is actually the dictation that is stored within the EHR. So it is not stored outside of the EHR. And with regard to DAX Copilot, It is also all housed within the secure realm of the Microsoft Azure cloud.
Great, thank you. Well, we're a Microsoft house ourselves. We're up at Microsoft's private cloud network, Azure, and so that bubble wrap of security, privacy, high trust is very much valued by our users and by many healthcare professionals. You know, from a practitioner's perspective, it was interesting. Maria and I went on site to a rather large facility and met with one of the psychiatrists there. You know, seasoned, been around for decades, excellent in his profession. And his frustration was, you know, I click, 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 click. I'm doing all this clicking. I'm doing all this documentation that's required from the medical payer perspective. But he said, I'm not telling the story of the patient. I'm missing that narrative. So exactly what you and Maria have been saying, I think it's going to be of great value in mental health and substance use disorders, because it will allow for that ambient review and pulling out those key pieces in a narrative to make sure that the story and the right story is being told. And I'm excited because it's going to help that generation of professionals, hopefully not retire anytime too soon, but it's also going to attract this next generation of phenomenal healthcare professionals to use technology, which they're so savvy with doing that. I think it'll be a wonderful addition to what we do and what we offer as far as tools. So let's show attendees, Maria, are you ready? Let's show them Dragon One Medical and how it works in AZZLY Rise.
Thank you, Coletta. And before I jump into that, I do see a raised hand or two, and may I just mention again to anyone who may have a question to please use the Q&A option at the bottom of Zoom so that we can make sure we do answer any questions you may have. And at this point, I would love to go ahead and share my screen. I am definitely excited to be able to provide a brief demonstration of Dragon Medical One and AZZLY Rise today. I will say that this portion of the webinar will be brief. However, that is only a direct result of the efficiency and speed that Dragon offers when documenting the patient records. So I am currently within the content of a psychiatric progress note in AZZLY. You may notice on the right side of my screen, I do have a small item here. This is my Dragon Medical One control, my control found benefit in the PowerMic mobile app that Dragon connects with. So I'm going to be using my cell phone today to dictate within this psychiatric progress note. The first item that I dictate will just simply be a statement that does not require any editing. It will be direct dictation. And in the box down below, I will actually use a pre-populated saved format that I have entered, and we'll show you how I can easily modify entries within that as needed as well. So now I'll begin my dictation within my interval history. Patient reports that her new SSRI is beginning to relieve the severity of her depressive feelings, period. She also reports that she started attending 12-step meetings approximately 2 weeks ago and is hopeful that she may be able to maintain sobriety if she stays engaged in the program, period. Assessed and educate. My little ball, one moment. Assessed and educated. Vital signs are within normal limits at this time, except for an elevated heart rate of 105, period. Patient reports that she was outside jogging just before meeting, period. Will reassess in 30 minutes, period. Limiting fluid intake as well as sodium intake as previously directed as a result of her congestive heart failure diagnosis, period. As you can see, I was able to pre-populate a statement and then was able to jump from the vital signs being within normal limits to adding additional detail. I also had the claim statement pre-populated that did not require updating, so I was able to navigate directly past that, and then populate my sentence as I needed to down below as well. That is as simple as clicking to manage auto texts and then typing whatever I need to within my screen as I would like for it to be named, or what I would like for my keyword to be spoken in order to populate the required documentation. So at that point, as I mentioned, I knew this would be short, but I was able to pass through quite a bit that would have otherwise required manual typing. So thank you for allowing me to demonstrate.
Maria, thank you. And I see we have a question in from Peggy Lavin. Peggy is with Accreditation Guru. She's been on many of our webinars. And Peggy, you asked a very good question in the Q&A. What requirements are built in for a clinical review of AI info data by the real life practitioner? Now, Accreditation Gurus, many of them are former Joint Commission auditors, and they're very, very focused on making sure that the Joint Commission requirements are met. So I think, Peggy, that's a very excellent question. And Rebecca, did you want to make a comment in regard to this?
No, I'll let Bonnie answer. Thank you.
Okay, thank you. So Bonnie and Maria had discussed this prior, and what the conclusion was is that it is the responsibility of that provider that is seeing that individual, that patient, to review thoroughly the documentation that they do, whether they use AI or they do it without AI. It's their responsibility before they finalize and sign. So Bonnie and Maria, if you want to make a further comment in regard to that.
Maria, would you like to add?
Coletta, I think you nailed it, actually. So
I did too.
as someone, you know, I consider when I document as a nurse, you know, then I know that I know what I am trained and what is required of me for my documentation. And while AI and other software provides such great solutions, you know, ultimately it's my license, not theirs, you know, who is writing on a patient. So.
Yeah, excellent, excellent on that one. So we have another question, and Bonnie, I don't know if you want to respond right now or have Matt respond. Distinguishing nuanced DAX solution for ambient note generation from competitors. What makes nuanced DAX maybe more advantageous to use than OpenAI, for example? And again, if we need to defer to Matt to respond to that, that's fine as well.
Well, actually, so Microsoft is a heavy investor in OpenAI. So they have preferential forms of responsible AI that they incorporate into the DAX Copilot program. And there are a few startup competitors out there. However, because DAX Copilot is an add-on to Dragon Medical One, typically those competitors don't have that ability to edit the note. And particularly with the specialties you have represented today, it is important that they have the pre-ability for a monologue versus the patient encounter or the patient visit, and then the post monologue in case there are certain things they would prefer the patient not hearing incorporated into the patient visit note.
Excellent, excellent. Thank you so much. So let's jump on. I think we're doing pretty good with, we're only 25 minutes into this. Let's go and address some questions. So on Dragon Medical One, some functionality questions that came in. Integration of AI-driven technologies, Dragon and EHR, especially after returning to work with physical limitations that may impede typing. How is the use of Dragon beneficial for someone who may have a physical disability with typing?
Right. So actually, it would allow them to dictate the note after the patient visit directly into the EHR, as Maria has shown. We can also, our training team can also, they're very good at this, personalizing commands. So anything that is said on a regular basis, our training team can help set up a shortcut or an auto text so that they would use a 3-word command and it would populate a paragraph or 2 of information. And then as Maria demonstrated, they can modify. So if that particular auto text is 95% applicable to a particular patient, they can modify what's specific to the patient very easily by navigating through that auto text. So it saves a lot of time for
That's-
them.
Another question, I want to gain knowledge on how I can improve documentation and save time.
So I guess I would compare that to typing a patient narrative after the patient visit. This would streamline, and from what we understand and the stats that we are being given, it could save up to 50% of the time documenting compared to typing.
That's big. So here's another one. If I'm taking notes during an appointment, will this technology use my bullet point notes to create a comprehensive HPI?
So we highly recommend using Dragon Medical One in the HPI section, assessment section, and plan section. So absolutely, our training team can help personalize the format for the particular user.
Okay, here's the next one. Does it work on a Mac?
Okay, so it is supported only on Windows devices only. That's what we're supposed to say. However, we do have some Mac users that are using Amazon Workspace or Parallels, but the vast majority of our clients are using either a Windows tablet, a laptop, or a desktop computer.
Okay, great. Thank you. Here's one. AI adds additional information to a record in their own words. Is this reportable to a payer?
So is it all right if I field that? Okay. So yes, absolutely. Because you've elaborated on a patient's condition within the HPI assessment or plan sections, that is where you can report as much as you'd like to a payer to justify whatever level of service you are presenting to the payer.
Okay. Maria, this one may be for you. Do you provide any documents? Because Bonnie, you really work off of, we have, Maria, explain our master library of forms.
Sure. So AZZLY has several hundred master forms that are based on that are categorized by medical, clinical, text, admission, administrative, releases, consents, and so on. And so we have the ability within our master form library as well to customize our forms if needed to contain the certain layouts that may be looked for. However, with using those platforms such as Dragon, then instead of having set in documentation that is already configured in the software, having your Dragon 1 dictation pre-populate that data with the ability to flow through it as easily as I just did, updating it, I believe that those needs would be met in either direction if I answered that correctly, Coletta, or appropriately.
Yeah, because again, it's not a matter of Dragon Medical One creating documents or forms for you. It's a matter of the forms, and I'm going to toot Peggy from Accreditation Guru's horn again, because we use Peggy and her team to review our assessments, our biopsychosocial, our treatment plans, etc. The Joint Commission and CARP are always changing standards or elements that they require professionals in behavioral health or mental health and substance use disorders to utilize. And on an annual basis, we look to keep our master documents up to date so that our providers can benefit from that. Having said that, I have no doubt that the Joint Commission and CARF and other accreditation programs out there are closely watching what's going on in AI. And there will probably be language that they may include or requirements that they're going to set expectations for treatment facilities to follow and medical providers to follow in their documentation, or also in their manuals to disclose if indeed they do use AI in documentation or notes. And there's nothing wrong with that disclosure or consents. And a question, how can I use AI as a therapist? Bonnie?
So with Dragon Medical One, we found that the recommended workflow is to dictate. So after the patient visit, you can put, just take small notes as you're having that patient visit, and then just dictating the whole visit after the patient visit allows you to focus on that particular visit and not trying to type summaries into your SOAP note on multiple patient visits during that day. So it allows you to, when you're finished with, after seeing your last patient for the day, you should be dictating your last patient visit note and ending your day. Hopefully timely.
Hey, Bonnie, I think you shared it's either your daughter-in-law is a LCSW, so she absolutely understands the space
Yes.
and the benefits. It's great. Is this HIPAA compliant?
See, absolutely, it is. Let me,
We're under security. And
okay.
and
So as I mentioned earlier, the only thing that's stored in the cloud and outside of the EHR is the user's voice profile and all their personalized commands. The actual patient narratives and the dictations are all stored within the EHR.
Great, thank you. Let's skip down to a little bit of questions here. Maria, how can AZZLY help me become a more efficient provider while maintaining documentation requirements?
Thank you for asking that, Coletta. I'm going to somewhat defer back to some of the benefits that I mentioned earlier, especially having the auto text paragraphs available. I know when I'm documenting on a patient, there's certain key points that I need to make sure I hit on, whether it's the education I provided, certain elements within my assessment, follow-up instructions, et cetera, that need to be documented. However, in a chaotic environment, it's so easy to accidentally let your mind slip over some of those items as you get called away or interrupted, or trying to hurry for your next patient. So to me, having the auto text so customizable that like Bonnie mentioned, I only have to say a word or two and it throws that text in there, and I can ensure that all of the elements that I need to go through to update have been touched on, and that my documentation is complete for that patient regardless of any distractions or time limitations.
Great, thank you. And I'm just reviewing some of the other questions. I think we pretty much covered in our discussion many of the questions. If there's some individual ones, I see there's some individual ones regarding I have a conference, I have a conflict, I'm not going to attend the webinar, but I do want a recording. Again, we do have the recording, and anyone who registered, and that's the benefit of registering to a webinar, is if you're unable to attend or if you have a conflict, we'll always send these recordings out to those that have registered. So definitely appreciate all the questions and those that found the time to be involved. So Bonnie, before we let everybody go, can you tell our audience what they should do if they're interested in learning more about Dragon Medical One and also about the DAX Copilot?
Absolutely. Andrew, if you wouldn't mind pulling up the last couple of slides, please. Thank you. So we have received approval from the developer to offer your attendees the ability to not only trial Dragon Medical One and the PowerMic Mobile at no charge, but also offer a PowerMic 4, a microphone, if, on all orders that are finalized by the end of March. There's plenty of time for those that are interested to get a trial set up, to conduct your own proof of concept. and to finalize an order. So this is something that we are pretty excited that we received special permission to offer your attendees today.
Well, Bonnie, thank you so much. Really appreciate that. So thank you, Bonnie. Congratulate Matt on the new baby.
Thank you.
Thank you, Maria, for joining us today and leading that demonstration. We will be continuing to offer webinars like this on topics that we feel are relevant to mental, behavioral health, and addiction treatment providers. Follow us on Eventbrite to stay up to date. Bonnie has promised us with the DAX Copilot, and I think we'll be able to schedule that hopefully in the March period. So we'll keep you apprised on that, March or April, to get that DAX Copilot webinar scheduled. We do have another one coming up in webinar. It's a topic we're terribly interested in, and it's introducing mental health services in a food bank setting. So for all of you and all your communities that you're in, there's food banks everywhere. There is a huge food insecurity going on in our nation. We're blessed that we're servicing just a phenomenal food pantry in the Illinois area that has introduced mental health services to those in need, meet them where they're coming to. And so we're really interested in sharing their success and hopefully encouraging other food banks and pantries out there that mental health care services could be offered at that level. So we're really excited about offering that in March, and staying tuned because Bonnie's promised us we'll do that DAX Copilot very, very soon. But remember, Dragon 1 first. Get used to Dragon 1, start using it, and then you're going to be able to introduce the DAX Copilot in. So thank you again to the panelists and attendees. Have a great rest of your Thursday. Goodbye.
Thank you, everyone.
Thank you.
Thank you.